Let's talk about the Dupuytren Research Group. What exactly is your group doing to find a cure?
Well, we are doing the groundwork that needs to be done to be able to test medicines for the way that they act on this disease.
Okay.
The problem is, right now, there's no blood test for Dupuytren disease, and it progresses very slowly. So if someone had a medicine that they wanted to test and see, does this slow down the progress of disease, there's no way to really test that in the same way that if you go to a doctor and you're worried about having problems with circulation, cardiovascular disease, the first thing is the doctor would check your cholesterol. Yes. And then if your cholesterol is normal, you're good. If the cholesterol is high, then you could have some kind of treatment, diet, lifestyle changes, or medications. And then you could test that again a month or two down the road and see whether you had made progress. And if you had, great. If you hadn't, then you'd try something different. We don't have anything like that for Dupuytren disease.
Okay.
And so we're kind of like the way things were before cholesterol was understood, which was people studied how well their patients did by reading the obituaries to see who had died of a heart attack or a stroke. And that's a terrible way to do research. So
yes.
The first step is to develop a blood marker, and we're doing that by a large international research study, the International Dupuytren Data Bank. And what this is we're recruiting people online and getting survey information about their health and their Dupuytren disease with online surveys. And then the next step will be to identify people from that group that have severe disease and use those to evaluate a list of potential blood tests. We have about 30 different tests which look as though they may be helpful, but someone needs to do the work to see whether they are appropriate or not.
Right.
And so that's a logistic difficulty, and it's costly because of the nature of the test that we're looking at, but that's what we're going to do. The goal of that is to identify some kind of blood test which is elevated when someone's disease is active and is lower when someone's disease is not progressing. And once we have that, that'll open the doors to be able to test all kinds of treatments, not just medicines, but lifestyle changes and nutritional supplements and whatever people want to try. They'll be able to have some benchmark that they can say, yes, this made a difference, or no, this didn't make a difference, move on to the next one.
And that makes sense, because what you're doing is you're trying to identify the population that has the active disease, do the blood test, figure out what factors are elevated and lower, and it makes a lot of sense. You know what's jumping to mind? They have done that with rheumatoid arthritis as well.
That's one of our models. So yes. Our models are the Framingham Heart Study, and
yes.
That was a longitudinal study that the result of which was that we found out that cholesterol is a biomarker and a direct risk factor for cardiovascular disease, and the work that has been done for rheumatoid arthritis. Now, rheumatoid has markers of disease, but the next step was to find what actually is circulating that is actually triggering the disease, and then developing an antidote to that. Right. And that's what Enbrel was. And that was a revolutionary thing for rheumatoid and now a whole host of diseases.
That's true. That's very true.
Our plan is to do this for the Dupuytren group of diseases, which are diseases in which scar tissue is not properly regulated, and any disease that has fibrosis in its name or sclerosis in its name is part of this general family. So the real lure is that if we can crack the code for Dupuytren disease, we may be able to have additional information that will apply to all these other lethal diseases, such as pulmonary fibrosis, cystic fibrosis, arteriosclerosis, cirrhosis of the liver, all of those bad diseases that also don't have good medicines for them.
Right.
So that's what makes this even more exciting.
That is exciting. That is exciting. And you have a lot of work ahead of you.
Yes,
I can tell that
yes.
already.
Right.
So for people out there right now, they're watching this program and they either have the beginning stages of the condition or they know of somebody that has the condition. Are there any words of advice you can give them?
Yes, the most important thing is to get a proper diagnosis and to have someone who knows their hands take a look at your hands and confirm or refute that diagnosis, and that would be a hand surgery specialist. There are a number of excellent hand surgeons around the country and around the world, My first stopping point for having a hand surgery referral is through the membership directory of the American Society for Surgery of the Hand. And the shortcut to that group, that's the Professional Society for American Hand Surgeons, the shortcut online is findahandsurgeon.com. You just run all those together, findahandsurgeon.com, and that'll bring you to that member directory, and you can plug in your zip code, your location, and find people that are near you. The other resource, which is patient-based, there are several different online patient support groups, and the most active one is the Dupuytren Disease Support Group, Dupuytren's Disease Support Group, or DDSG, which is a closed Facebook group, but they have over 1,000 members, and they share information about what they're going through on a personal level and their experiences with doctors. And it was actually through a group similar to that that got me interested in Dupuytren disease as a real specialty in my practice in the first place. Yeah.
Okay,
so
that's good.
Those are both great resources.
Perfect, perfect. Okay, so people are out there. What if they want to help you? I mean, is there any, can you point them towards your website? And I know you have some things going on with legislation as well.
Yep, we have a couple things going on. The first is that our website is dupuytrens.org. That's a hard one to spell, so the shortcut to that is number 4 DUP.com, just 4DUP.com, and that'll send you over to our main website. And we have two things that are coming up shortly. One is that tomorrow I'm going up to Tallahassee to be there for the recognition of April 1st as Dupuytren Disease Awareness Day in Florida. And we have a campaign to try to do this around the country, and the web link to that page is nodup.com. That's KNOWDUP.com, and that'll bring you into a page that'll facilitate your suggesting this to your state members of Congress. And then the other thing we're doing locally is we have an awareness luncheon scheduled for April 27th up at Old Marsh Golf Club, and that event is being organized through eventbrite.com. And so the link to that is dup.eventbrite.com, and that will
so there are multiple ways to get involved.
Yep.
Okay, the important thing is we definitely do need to find a cure. I can see that, definitely.
Right.
Well, on behalf of the entire PlumbTalk team, I'd like to thank you for joining us. We really enlightening information, so thank you.
Well, thank you very much for having me. I really appreciate it. Thanks.
Oh, you're welcome.